Yeah, I think there's like two layers, right? So first is the AI layer, and then second is actually a actual physician layer. So when it comes to AI, because we are integrated with the long-term care EMRs, so we exactly know what's happening with the patient's health, especially like, okay, in the morning, as soon as they get up, how their health is, and we have like data for almost like few years of data. So we use that all this data to say, okay, what is our current data says, and then we already make a validation on like, okay, this is something that is out of range for this residence at this point. So it actually pops, like there's a pop-up that comes up on their dashboard saying, hey, there's something wrong, there's a deviation. You either reach out to your physician, who's part of the medical director, is part of these facilities.
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joan Camargo, and my guest here today is Sathya Elumalai, who is the founder and CEO of Aidar Health. Sathya, thank you so much for being here today. I'm super excited for this conversation, and welcome to the podcast.
Thank you so much for having me. It's an honor and pleasure to be here.
Amazing. I would love to start off in the exact same way I start all of these conversations with, which is just the guests sharing a little bit more about themselves, who exactly they are, what's their company, and something that I've started reframing now is what's the big problem you guys solve? I think it's always a good way to start things off. So why don't we get there?
Yeah, no, I think our company is called Aidar Health. It says Aidar Health. Before a lot of people start talking about AI, we actually built an AI company almost like a decade ago. But then our core focus was, okay, there are a lot of people, especially in healthcare, they are using softwares and platforms to actually help prevent hospitalization or any kind of emergency events. But the biggest challenge that with all these different technologies is like you don't have rich objective data about patients' health, which is what was our focus. So when some of my friends who started the companies with me and made it to $1 billion company, I took the hard route or the hardware route where we built a medical device. Essentially, this is our device. It's more like a breathalyzer. It measures around 12 health parameters in under a minute, and using that data to actually help provide a more 360-degree view of somebody's health.
That's
So
amazing.
that's what we are doing right now. We are using the device, the technology that we are using to actually help predict adverse events, and also we're working with physician network to help address the clinical aspect as well. So we're giving a full spectrum of services and technology so that there's no gaps, and we also ensure that the right care is provided to the right patients at the right time.
Awesome. Very, very cool. Thank you so much for sharing that. And I wanted to just pinpoint something a little bit more, even just going a next level layer deeper here. Of course, this sounds like it can be helpful in a bunch of different scenarios. But if I recall from some of our other conversation as well, you guys are actually really honing down right now in nursing homes and practitioners who are helping patients in those sectors. Is that correct? Tell me a little bit more about the use cases in there as well.
Absolutely. I think the inspiration behind this was my mom, and she had 4 chronic conditions, and I wanted to build something to help monitor her health. So it was more or less a technology for home-based use so that we can manage patients or people within home setting. But honestly, over the past like 2 years, I've been traveling around like hundreds of long-term care facilities across the country, and the biggest challenge is there are no like advanced technologies there. And a lot of time, long-term care is more focused on, okay, if somebody coming from a hospital for a short-term stay, they do everything to make sure that they don't get re-hospitalized. So there's like really good kind of care provided. But people who are in like long-term or memory care, basically people cognitive decline,
Yeah.
it is there's no technology there. And sometimes it's really sad that people look at it as, okay, people in hospice or memory care, they just look at it as, okay, what this health monitoring going to do to them,
Mm.
uh, let's keep them until we can occupy that bed. That's the mindset that they had, and which is why for me, I wanted to see how we can address those challenges. So that's why we decided to start working with the long-term care facilities, and specifically with skilled nursing facilities where they still need to take some measurements of health. I mean, seeing how the patients are doing on a day-to-day basis. So we felt like a technology like this would be like far superior for that setting, but
Yeah.
also very helpful to actually see the gradual worsening or improvements of health every single day, so that there are a lot of I mean, I have a lot of great examples of how
Yeah.
our technology helps, but that's where we see this is a place where we can touch a lot of people at the same time, and there is support for us to actually use nurses and CNAs to take measurements versus calling patients and asking them, "Hey, can you take a measurement?" Right?
Yeah, yeah, that can become complicated, I would assume, for
Exactly.
sure. But yeah, but that's really awesome. Thank you so much for sharing that as well. And I think something that I always, when I'm having these conversations, there's cool things that sometimes people can hear and just look straight over their head and they don't even acknowledge it. Something that's really, really cool. And it's actually become quite a recurring pattern in a lot of the conversations I've had is one, data, right? Data
Hmm.
is existent everywhere. So many companies are also like inundated with data. There's so much
Hmm.
data. Knowing how to use that data is a completely different story. And then next layer deeper again, we're just peeling the onions here, peeling the onion here for you. You guys actually get the clarity on, you guys get the clarity over that data as well. So in a situation where oftentimes maybe the patients or the practitioners, whoever that might not be aware that there are, I think you said 12 parameters, 12 things that are happening with this patient. Now, through your tool, there is that clarity. There is many more options of how do we take this from here and how do we actually improve this patient's health or do everything that we can to improve their health. So that clarity on the data and then utilizing the data is so, so awesome. So I wanted to highlight that too as well. And then tying to that point, when you're having those initial conversations with the practitioners who I would assume are the ones that are utilizing this on the day to day in the nursing homes, is there any form of hesitancy? Is this something that they see? They're like, oh, I'm not so sure about this. Talk to me how that first few interactions actually go for them to get a good buy-in and really think that this is something that they can use in their day to day to help them.
No, I think 100, uh, almost like 100% of the time, people look at it, oh, wow, this is awesome. But then, do I need to do it? I don't have the time. I don't want to use another system. I don't want it to, even if it's just another tab that they need to click, they don't want to do it. And
Mhm,
oftentimes, it's people don't see the value of it.
mhm.
And the biggest challenge is the administrators, the nursing home owners, they understand the value. They know like how much of cost savings this would be,
Yeah.
how much avoidable or hospitalizations they can save money on, and how they can better manage their like capacity and census within their
Yeah.
facility. But the people who are actually on the ground taking the measurements and monitoring the patients, they don't want to really even use any new technology.
Mhm.
There are like, for example, they call the nurse on a stick kind of a technology where you have a pole with the blood pressure cuffs, pulse oxes, and everything attached.
Mhm.
So they use that, and sometimes the hard reality is even if they don't use it, they carry their own blood pressure cuffs and pulse oxes in their bags. These
Mhm.
are like $10 Amazon or maybe Walmart brands, which are not FDA cleared. And oftentimes we see like strange like data that comes in with different wide variety of numbers.
Yeah.
So there's always a pushback. But what we end up doing right now is having our own team member be there for at least
Mhm.
like, although the actual deployment takes like a couple of hours,
Mhm.
we end up having one of our associates be there for
Mhm.
at least a month. We walk through them. First, we say, okay, we are taking this measurement for a week. You see
Yeah.
it, and then the next week onwards, we follow up. We start with like, okay, let's start with like 10 residents or 10 patients,
Mhm.
and then we expand to like everyone in the facility. So the most important thing is after like few months of use, we were able to show, hey, here, see the value, like how many hospitalizations we could save, or like anytime, because most of the time people are given medication based on their vitals.
Mhm.
Sometimes people ignore. So we take all those use cases and the successes that we had and then present it to people in other facilities
Mhm.
so they
Mhm.
see the value. So
Mhm.
for example, one of the times where I was at a facility training a nurse to take vitals, and then one of the patients, she was doing fine, like from appearance perspective, but then when we took a measurement with our device, our SpO2 level was, or like oxygen
Right.
saturation was significantly low. They don't take oxygen saturation on all the patients. They don't take blood pressure or like any other parameters on all the patients. So I saw that, and then I took repeated measurements every time it was low, and then I reached out to the facility and informed them, hey, here's something that's happening. And then they actually were able to contact the doctor, take care of the patient, and then
Mhm.
actually was able to send her to the hospital before things got really bad.
Yeah.
So
Which otherwise wouldn't have happened.
exactly. So
Yeah.
that's the power of measuring a lot of other
Mhm.
parameters at the same time. And that's the day, like, I felt really, my 10 years of effort was really fruitful, because
Yeah.
the nursing director came and said, hey, you already saved one life, which was what we're working towards.
Yeah. That's
And which is
amazing.
why we get like all these amazing validations, and we take those and then communicate with other facilities so that they see the value.
No, that's so awesome. That's so awesome. And I actually wanted to look at this in a couple different perspectives. And I also wanted to touch on a few of those measurements that you guys actually go through. You don't have to give me all 12, or else it would probably be an explanation for a couple hours here on just going all these amazing things that can come from them. But one is, I actually did not expect the answer you gave me. I expected it to be quite the opposite of what you said, in who is really, oh, I love this, and who is like, oh, I don't want to use this. I thought it would be you telling me that the facilities are like, hey, oh no, like, let's keep doing the same thing that we're always doing. And then the practitioners themselves saying, oh, I love this new technology. Let's go through with it. But you told me it's quite the opposite. So that's one, very, I'm surprised to hear that. But two, I'm curious to hear, when you're having those conversations, just to, I guess, lean towards a business conversation here as well. Who actually makes those calls in the back end for you guys? Is it the actual facility? Like, hey, this is something that we value. This is something that, even though you might not want to adopt it in your day-to-day routine, Mr. Practitioner, we're going to make you do it because we are going to be able to save some lives with this. So who's the one that's actually making that call when you're having those conversations?
Yeah, I think there's like two layers, right? So first is the AI layer, and then second is actually a actual physician layer. So when it comes to AI, because we are integrated with the long-term care EMRs,
Mhm.
so we exactly know what's happening with the patient's health, especially like, okay, in the morning, as soon as they get up, how their health is, and we have like data for almost like few years of data. So we use that all this data to say, okay, what is our current data says, and then we already make a validation on like, okay, this is something that is out of range for this residence at this point. So it
Mhm.
actually pops, like there's a pop-up that comes up on their dashboard saying, hey, there's something wrong, there's a deviation. You either reach out to your physician, who's part of the medical director, is part of these
Mhm.
facilities, or and also like we have a physician network that we partner with. They based out of Florida. They have over 20 physicians.
Mhm.
They are seeing the data every single day. So
Nice.
we have a system in place. They're also not scrolling through every single patient,
Yeah.
but we have a system in place where, again, using some kind of a machine learning, we actually show like which patient is at high risk. So on an average, a physician is looking at probably 5 to 10 patients at a time. So they get like much better clarity on
Mhm.
everything.
Mhm.
Plus, we're also pulling data about their health and presenting it there. So at a time, we get a snapshot of patient medical history, longitudinal analysis of all their vitals, and what really happening at that point.
Mhm.
So those doctors actually call the facility and tell them, hey, you missed out something. Here's something that you could do. Or actually, every facility has doctors who manage a couple of patients, not all of them.
Mhm.
So we have those list of physicians. So we contact the physicians and inform them, here is what is happening. What kind of recommendations do you have?
Mhm.
So,
Mhm.
and we either communicate that to the facility, or the doctors themselves will communicate.
Mhm.
So we act as more like a remote command center to help monitor patients 24/7.
Mhm. Very, very interesting. Very, very interesting. Thank you for sharing that as well. It's nice to see the different groups that are working sometimes separately in a way, but then everything comes together to get that end outcome that everyone is looking for. So that's really awesome. I wanted to ask you, and you might be aware of this too. In this podcast, I love to highlight the challenges. I think is, as entrepreneurs, people looking at us from the outside looking in, sometimes it can just look like sunshines and rainbows. And we all know that's not the truth, right? There's many things along the way. Even for us to make sure that we're, hey, when can we find a time to have that conversation? There's many things that can get in the way on my side and both of your side too. So talk to me some about a little bit more about that. When you're looking at the growth of the company, where you guys are trying to get to, and of course the impact that you want to reach. What are some of the day-to-day challenges, things that are always knocking on your door, um, that are hurdles to achieve that end goal that you guys have for the company? Or maybe not an end goal, but we're more so like keep progressing over and over.
No, I think when I started the company 10 years ago, my goal was to touch 1 billion people in a positive way. So, how can I use technology or some kind of an innovation to get to as many people as possible? An innovation that could be an integral part of every single person's life. So, that was a thought process. And at that time, I didn't think the uh, AI would play a significant role. We were
Yeah.
just collecting data. But right now, I think that vision of getting to that many people is actually really possible. And like
Mhm.
it's not going to take like 10 years or 20 years, but it could be possible in the next 5 to 10 years and 5 to 6 years. So
Mhm.
there's huge possibility because of that. But then the challenges, as you said, like there's everything from business challenges, operational challenges, even marketing related challenges. So
Mhm.
if I could break it down from business related challenges, there's always that data and validation, like how much have outcomes that you have created, or what is this technology has done.
Mhm.
So it's not like something you take a medication and then the pain is gone, so you
Mhm.
can show that, hey, did you see this pain is gone?
Yeah.
But this is a technology that you needs consistent use over a period of time, so that we can use machine learning to predict w- the decline in patients' health, to see like what's
Mhm.
happening. Did we see this pattern before? Did we see the same pattern in somebody else in another facility or in another country?
Mhm.
So we could, in order to achieve that, the scale, we need to achieve a large scale. So oftentimes when you go like apart from all these like messages, apart from all these validations that we get, we still always have like payers ask us, hey, we need like 2 years of data, 3 years of data to show, and how many hospitalizations have you saved, how many ER visits, or how many times your system is alerted and actually made some recommendation that was valuable. So we are working towards that, and so
Mhm.
it's a hard sell from that perspective.
Mhm.
And also this is like a chicken and egg problem, right? Every time, starting from the day that we started the company, to does this technology works, and then to does it have an FDA clearance? Once
Mhm.
you get that, then they ask like, okay, how many
Mhm.
people have you touched? What is the clinical data on that?
Mhm.
And so right now, as we try to raise more money, there's again another set of like, okay, how many people are using this? How can you scale this
Yeah.
technology?
Yeah.
So we are trying to handle that as well, because there's a lot of investment goes into AI, but
Of
then
course.
people don't like realize that we are the engine that's going to actually power the AI, right?
Mhm.
Without our data, it's going to be very difficult.
Mhm.
I
Mhm.
mean, I consider ourselves as an AI company as well, but because of the hardware, people just go into thinking like, hey, it's a hardware
Yeah.
company,
Yeah.
and that's how it
Yeah.
is.
Yeah. But you
So
can't improve what you don't measure, right? If there's nothing to measure, how
exactly.
are you going to improve it?
Exactly. So that's where, for example, I mean, fundraising has always been a challenge for us, but also operational wise, as I was saying, right? It's a huge uphill battle, like going into each of the facilities, because they have this mindset like, okay, how is it going to like help? Because I mean, the people in the actual floor, the nurses and CNAs, they don't really realize, okay, how can we save some time for them? How can we like help the residents or the patients there? They look at it as if somebody's sick. Yeah, they're going to go to the hospital and they're going to get a better care, and then they're going to come back. But
Mhm.
they don't understand the economic value behind it, the loss of revenue for the facility. There's
Yeah.
no there's no clear communication. So, and it's not just one facility. I've probably been to like hundreds of facilities, and it's the same thing every single time. I mean, you can talk about the technology. I always talk about my mom and how I worked on it. I mean, nothing really gets to them. It
Mhm.
just comes down to it's going to be an extra work for me.
Mm-hmm.
Although we are replacing 10 devices into one, it's very hard.
Yeah,
So
that framing for them is difficult to understand. I understand.
exactly.
Yeah.
And then it's
Mm,
also, I mean, as that also talks about the marketing challenges, right? So if it's a doctor, it's easy to market it. We know what channels we can go. If it's a administrator, we know what channels and how we can target. They know the value, the cost savings, and everything. But we don't know what channel to target nurses and CNAs, right? We don't know even the residents who are there, like,
mm,
because sometimes patients say like, hey, I don't want to take this measurement today. I wanted to sleep in. So,
mm,
which is where I oftentimes like look up what creative ways in which we can use some kind of a good marketing channel to like target, educate all the people who work in a nursing home setting
yeah.
so that they they actually understand the overall value and understand like how important it is their day is, because until and unless they understand the importance of their time and then what they're doing to the patient, it's going to be
Mm,
hard to bring in
yeah.
any technology.
Yeah. Well, no, that's so awesome. And I like the way that you're thinking about it as well. And usually for me, whenever I'm encountering any type of situation, I'm like, hey, how can we break this down backwards? So like the goal is to implement this, right? But for them to implement this, they have to want to understand the value. So they have to be educated on it. And for them to be educated on it, they have to be aware of it first. And for them to be aware of it first, we have to know how to get to them to be aware, right? So it's breaking down these things. So it's really awesome the way you're thinking about it as well. So thank you so much for sharing that too. As I'm sure you know as well, Satya, I usually have one question that I like to ask every single guest on the podcast, and I think it'll be the perfect opportunity to ask you that question as well. And it's the magic wand question. If you had that amazing magic wand that could solve just one of these couple different challenges that you mentioned to me that would allow the business to reach all the client acquisition goals, all the revenue goals, and most importantly, as a result of that, the impact goals, the lives that you save, what would you say is that magic wand? Solve that thing, everything gets achieved in this hypothetical world scenario.
I think it's essentially just changing the mindset of people, right? I think literally I
Education.
feel like, yeah, just I feel like if there is a switch that I can flip and then just say, okay, here's what the value of it, of the technology, and also for us, a lot of people ask like, why do you have to measure so many parameters?
Mhm.
These patients, I mean, our patients don't need these things. We only need a pulse ox or one of these devices.
Yeah.
But for example, like Tesla, right? They are transition. They're actually a data science company.
Mhm.
Everybody looks at it as a car
Yeah,
company, but
yeah,
they're a
no, yeah,
data
for
science
sure.
company. The amount of data that they are collecting and providing the 360-degree view of every car, every passenger, where they're going, we are providing such a technology for health. So we're collecting the largest digital data set on human health, and we wanted to see like I wanted to see like, okay, without taking all these efforts, can I fast forward like 2 years from today so that I
Yeah.
have all the data and then like I'm just talking about the value of it.
Mhm.
So that's what it is. I probably wanted to like fast forward, get to a point like where here is the data and here are some publications,
Mhm.
so I don't have to keep communicating the value every single person, but rather just put it out there and actually scale this product to like hundreds of thousands of people.
Amazing, amazing. Thank you so much for sharing that. And I have my final question for you here now, which is not a question from me. It's a question from our last guest to you. And here's the question that they had for you. And they had no idea who you were, just in case you didn't
Okay.
know that, but I think you knew
Nice.
that. They had no idea. So here it is. What is the most effective way that you wind down and wrap up at the end of the day? Do you have any sort of routine to prepare for the following day?
I think, I mean, I don't want to be too philosophical, but for me, it is, I mean, every day is challenging. I just come back and I feel like drained fully.
Mhm.
But I really look back at some of the conversations that I had with the patients. For example, yesterday I had a talk with a patient who was in a nursing home. She was actually a doctor, but then
Mm,
she's now a patient sitting down. And then she actually spent like at least 15 minutes talking to me about like how awesome it is. Initially, she was so skeptical about the
mhm,
solution, but then once I explained it to her, she became a spokesperson for me.
mm.
And she
Nice.
said, hey, this is going to be a great technology.
Yeah.
So I just always go back and then like think about it, and also whatever challenges that I went through. I always think about my parents, and because I lost both of them last year.
Sorry to hear that.
So I just always look back and say, "Hey, I'm gonna do this for you guys."
It's beautiful.
And the last thing that I really think about is I don't want to quit. So I just feel like I want to keep going, and then I want to ultimately take this company to an height where there's hundreds of thousands of lives are saved. So all those things combined is what really put me in. And then I listened to something like something spiritual, and then just call it off for the day.
Amazing. Amazing. Satya, that's awesome. Thank you so much for sharing that. Thank you for such a phenomenal conversation. Where should people go if they want to learn a little bit more about you, and of course also a little bit more about the company and everything else that you guys have going on?
Absolutely.
Where should they go? Where
Uh,
should they go? Tell me.
Oh, okay. Yeah. Basically, aidar.com, aidar.com. And you can also reach out to me at CEO at aidar.com. We are all our social media channels, Aidar Health. So please reach out to us and like let us know some of your thoughts. And if there's any way that you could help us out, let me know. That'll be very helpful.
Amazing. I'll, of course, leave as many links as I can down below here. If you are hearing this conversation, you want to check that out. And if you're listening to this episode and you enjoyed this conversation, you want to hear even more conversations like this, please also hit the subscribe button, and I will see you on the next episode. Satya, thanks so much again for your time. Thank you.
Thank you so much. It's a really pleasure talking to you. And definitely, it was a fantastic opportunity to showcase all what we're doing this year.
Awesome. Thank you.